Chapter 2. Healthcare Crisis, Pandemic Aftermath, and Universal Care Debate. 2.1 American Healthcare, a System in Flux. The American healthcare system has long been a subject of intense debate and scrutiny, situated at the crux of social, political, and economic issues. Throughout its history, it has manifested a complex web of private and public sector involvement, marked by innovations in medical technology, fluctuations in policy, and ongoing discussions concerning the balance between market freedom and governmental oversight. At the heart of the healthcare dialogue in recent years has been the impact of pandemics and the debate over the adoption of universal healthcare, a debate fueled by disparities in access and quality of care, as well as the ever-rising cost of services. In grappling with the aftermath of a global pandemic, the United States confronted unprecedented challenges, many of which amplified pre-existing cracks within its healthcare infrastructure. The pandemic overwhelmed hospitals and clinics, creating urgent demand for medical staff, hospital beds, ventilators, and personal protective equipment. It exposed the fragility of the system, showcasing not just the heroic efforts of healthcare workers, but also the dire consequences of underfunding, lack of preparedness, and the perils of unequal access to care. The heavy burden of the crisis laid bare the inequalities and inefficiencies of the existing framework. Primary among the pandemic's revelations was the pronounced disparity in health outcomes correlating with socioeconomic status, race, and geography. Communities already disadvantaged due to systemic inequalities experienced significantly higher rates of illness and mortality. Data showed that minority groups, particularly African Americans, Hispanics, and Native Americans, were disproportionately affected by the pandemic. This raised critical questions about the social determinants of health and the role of government and policy in addressing these disparities. The crisis served as a catalyst for renewed discussions about universal healthcare and the need to ensure that all individuals, regardless of background, have access to quality care. The debate over universal healthcare is far from new, but it took on heightened significance in light of the pandemic's burden on the American system. Proponents argue that a universal healthcare model, similar to those in other developed countries, is essential for safeguarding the health of the nation's populace. They cite the high costs of healthcare in the United States, the number of uninsured or underinsured individuals, and the improved health outcomes in countries with universal systems as compelling reasons for reform. Advocates claim that adopting such a system would not only improve individual health outcomes, but would also be more cost-effective in the long run by preventing diseases and reducing the need for expensive emergency care. However, the concept of universal healthcare is met with strong opposition from various quarters. Critics raise concerns about the potential for decreased quality of care due to overburdened services, longer wait times for treatment, and a lack of innovation driven by competitive markets. They point to the substantial taxes that would be required to fund such a system, and suggest that this would lead to decreased personal freedom in choosing healthcare providers. Furthermore, critics argue that a one-size-fits-all healthcare system ignores the complex and varied healthcare needs of a diverse population. The pursuit of a solution has birthed an array of policy proposals, from incremental reforms to comprehensive overhauls. The Affordable Care Act, ACA, passed into law in 2010, represented a significant step towards expanding access to healthcare and protecting patients from insurance industry abuses. Despite its achievements in reducing the number of uninsured Americans, the ACA faced challenges in implementation due to political opposition and legal battles, as well as persistent issues such as rising premiums and limited choices in certain markets. One approach to healthcare reform that gained traction following the pandemic is the policy of Medicare for All, an idea advocating for the expansion of the federal Medicare program to cover all Americans. The proposal contends that by leveraging the government's negotiating power, it is possible to reduce drug prices, administrative costs, and ultimately, the cost of care for consumers. Medicare for All also emphasizes the principle of healthcare as a human right, ensuring that every individual, irrespective of their income or employment status, receives the care they need. Another significant part of the discourse on healthcare reform is the concept of a public option. This policy would allow Americans to choose between private insurance and a government-run insurance plan. The principle behind the public option is to introduce competition into the marketplace with a potentially lower-cost, government-backed alternative intended to drive down prices across the board. Its proponents see it as a more politically palatable and pragmatic step toward universal coverage, as opposed to an outright overhaul of the healthcare system. Parallel to these discussions, there is an ongoing exploration of alternative models and the role of innovation in healthcare delivery. This includes an increased reliance on telemedicine, which saw a dramatic rise in use during the pandemic lockdowns when traditional in-person visits became difficult or impossible. Telemedicine expanded access to care for those living in remote areas or with mobility issues, and demonstrated the potential for technology to improve efficiency and reduce costs. However, there are concerns about the adequacy of virtual care compared to face-to-face interactions and the challenges of ensuring equitable access to the necessary technology. The financing of healthcare also remains a key issue. Currently, the United States spends a greater portion of its gross domestic product, GDP, on healthcare than any other developed nation, yet it does not achieve the best health outcomes. This discrepancy highlights inefficiencies within the system and a need for better resource allocation. Spending debates often circle around preventative care and the overall approach to health, suggesting that increased investment in preventative measures could reduce long-term costs by avoiding chronic diseases that are expensive to manage. Strategies for bolstering the healthcare workforce have also become a focal point, especially in the wake of staff shortages highlighted by the pandemic. Training and retaining skilled professionals such as doctors, nurses, and support staff is crucial for the sustainability of healthcare services. Investment in education and incentives to work in underserved areas are among the measures considered essential to improve workforce numbers and distribution. Moreover, there is a push to recognize and address the mental health toll on healthcare workers, emphasizing the need for support systems and resources to help them cope with the strains of their profession. 2.2 Pandemics in Public Health, Lessons from COVID-19. The COVID-19 pandemic has had an indispensable impact on the fabric of global health and economy. Nations found themselves in a health crisis of unprecedented magnitude in modern history. Ever since the identification of the novel coronavirus in late 2019, the disease rippled across continents, challenging existing healthcare systems and disrupting the historical precedents of public health responses. The United States, with a healthcare system that is both robust and riddled with complexity, found itself at the nexus of a dire public health emergency and a contentious debate over the future of healthcare delivery. As the nation emerges from the acute phases of the pandemic, it has become clear that lessons from this ordeal must inform future health policy and crisis management frameworks. The early stages of the pandemic exposed vulnerabilities within the American healthcare system. One of the most glaring issues was the shortage of personal protective equipment, PPE, for healthcare workers. Despite being a developed country with advanced medical technology, the United States faced critical shortages of masks, gowns, and other protective gear, leaving frontline workers inadequately protected against the virus. This PPE crisis not only endangered healthcare workers, but also symbolized a systemic failure to prepare for a predicted event like a pandemic. It highlighted the need for better strategic planning, stockpile management, and the ability to upscale production and distribution of essential medical supplies during emergencies. Testing for the virus became another significant point of contention. It soon became clear that widespread and accessible testing was crucial to understand and control the spread of COVID-19. The United States, however, struggled to provide testing to all who needed it during the early months. Issues ranged from supply chain disruptions to regulatory bottlenecks, which together delayed the deployment of tests and hampered efforts to track the virus's spread. This lapse compromised the ability to implement effective containment strategies such as contact tracing and targeted quarantines, leading to broader and longer-lasting outbreaks. The inequities in healthcare access were magnified during the pandemic. Minority communities, particularly African American and Hispanic populations, experience disproportionately high rates of infection and mortality. The reasons are multifaceted, including higher exposure risk due to essential jobs, less access to quality healthcare, prevalent comorbidities, and distrust in the medical system stemming from historical abuses and ongoing discrimination. Addressing these disparities requires a multifaceted approach, ensuring equitable access to healthcare resources, improving social determinants of health, and rebuilding trust within these communities through culturally competent care and policies. Another byproduct of the pandemic were the mental health ramifications. The long-term psychological impacts of widespread illness, death, isolation, and economic instability are profound. Healthcare providers reported increased incidences of anxiety, depression, and substance abuse, signaling an urgent need for expanded mental health services. The pandemic prompted an unprecedented reliance on telehealth services, which, despite some limitations, has proven a vital tool in reaching patients who otherwise might have gone without care. It underscores the importance of integrating mental health services into broader healthcare policy and ensuring these services are readily accessible to all. The pandemic also showed the implications of politicizing public health issues. Mask wearing, social distancing, and vaccinations became topics of political debate rather than purely scientific discussions. This polarization hindered public health messaging and compliance with recommended guidelines. To protect public health, there needs to be a concerted effort to insulate health communications and policies from political influences. This involves promoting health literacy among the general public and ensuring that public health officials can convey important messages without political interference. The surge in patients with COVID-19 also laid bare the limitations of hospital capacity and resource allocation. Hospitals in hard-hit areas were overwhelmed, facing shortages of beds, ventilators, and critical care staff. Difficult decisions about who to treat and how to allocate scarce resources brought bioethical considerations to the fore. It reinforced the need for clear, ethical guidelines on resource allocation in times of crisis, and called into question the resilience of hospital infrastructures under extreme stress. Investment in healthcare infrastructure, including surge capacity for hospitals, cross-training healthcare personnel, and mobilizing resources expeditiously, must be a priority for future crisis preparedness. The role of global health governance also came under scrutiny during the COVID-19 crisis. International organizations like the World Health Organization, WHO, faced criticism for their response to the pandemic. While global cooperation is essential in managing pandemics, nations, including the United States, recognize the importance of self-reliance in critical areas like pharmaceutical production and medical supply chains. Balancing international collaboration with national readiness is key to preparing for and mitigating future global health threats. Scientific research and development emerged as a triumph amidst the pandemic's hardships. The unprecedented speed of vaccine development demonstrated the remarkable capabilities of modern science when adequately funded and supported. The success of mRNA vaccine technology has opened new pathways for combating not only COVID-19, but possibly a range of other diseases. However, the distribution and uptake of these vaccines also illuminated issues of vaccine equity and hesitancy. Ensuring that all populations have candid and reliable information about vaccines, along with fair access, is essential in combating not just the current pandemic, but also in preventing the next one. As we look to the future, there is an ongoing debate about universal healthcare and whether it could have mitigated some impacts of the pandemic. Proponents argue that a universal care system would provide comprehensive coverage, improve population health outcomes, and may lead to more coordinated crisis responses. Critics caution about the financial sustainability of such systems, potential for reduced medical innovation, and government overreach into personal health decisions. The pandemic has not resolved this debate, but has undoubtedly intensified it, bringing to light the consequences of gaps in coverage and the potential benefits of a more universally accessible healthcare system. Finally, the economic impact of the pandemic and its relationship to healthcare cannot be overstated. The closures of businesses and loss of jobs created a cascade effect, reducing individuals' ability to afford healthcare and increasing their reliance on public health programs. The economic crisis also strained healthcare providers, from small practices to large hospital systems. Funding public health adequately is pivotal, not just for individual health, but as a cornerstone of a stable and functioning economy. The interdependence of health and economic policy has perhaps never been as evident as during the COVID-19 pandemic, underlining the need for policies that support both a resilient healthcare system and a robust economy. The United States, along with the rest of the world, continues to grapple with the aftermath of COVID-19. It is evident that the experience must serve as a blueprint for future public health emergencies. The lessons learned pertain to the preparedness of medical systems, the implementation of public health strategies, and the creation of equitable healthcare policies. The insights gained from this experience are invaluable. They should inform a proactive stance on public health that is both comprehensive and adaptive to the dynamic landscape of global health threats. The pandemic's legacy, while marked by tragedy, can pave the way for a more resilient and inclusive healthcare system. 2.3 The controversy over universal healthcare. The topic of universal healthcare in the United States has been a subject of ongoing debate. It encompasses a spectrum of opinions, ranging from a complete government-run system to mixed models that incorporate private and public elements. Discussions on universal healthcare often touch some of the core values of American society, including freedom of choice, the role of government, and fiscal responsibility. As the world has faced unprecedented health challenges due to the COVID-19 pandemic, these conversations have become more urgent and polarized in the United States. The proponents of universal healthcare argue that it is a fundamental human right. They posit that ensuring every citizen has access to healthcare is both an ethical obligation and a practical necessity for a healthy, functioning society. Supporters contend that in the wealthiest country in the world, it is indefensible that there are millions without health coverage. They suggest that universal healthcare leads to better health outcomes and can potentially reduce overall healthcare costs by streamlining administration and focusing on preventive care. However, detractors respond with concerns about the potential inefficiencies and increased taxation that could arise from a government-run healthcare system. They argue that government involvement could lead to reduced quality of care and longer wait times for treatments due to rationing. Critics also caution against the removal of free market competition, which they claim incentivizes innovation and keeps costs down. Fears of increased federal deficits and economic repercussions further fuel opposition to the movement for universal healthcare. Proponents of universal healthcare also highlight the issue of medical bankruptcy, which affects thousands of Americans every year. They argue that with universal coverage, individuals would not have to face financial ruin due to unforeseen medical emergencies or chronic conditions. In addition, advocates note that economies of scale and bargaining power in a universal system could lead to negotiations for lower drug prices and medical services, thus making care more accessible and affordable for all. Opponents, however, raise questions about the impact of universal healthcare on personal autonomy. Many are concerned about the potential for government overreach and the loss of individual freedom to choose providers or the type of coverage they desire. Skeptics of universal healthcare systems often tout the advantages of health savings accounts, HSAs, and other market-based solutions that emphasize personal choice and responsibility. They insist that maintaining a variety of coverage options is crucial to cater to the diverse healthcare needs of the population. The debate about universal healthcare has also been tied to discussions on quality and innovation. Proponents argue that a universal system could drive standardization of best practices and wider access to high-quality care. By reducing administrative burdens on healthcare providers and emphasizing preventive and primary care, such models could contribute to overall healthier populations. Additionally, supporters often point to other developed nations that have successfully implemented universal healthcare with notable health outcomes. Critics counter by highlighting instances of innovation driven by the competitive U.S. healthcare market. They claim that the profit motive in a private healthcare market is key to the development of new treatments and medical technologies. The possibility of decreased funding for research and reduced incentives for medical innovation under a universal healthcare system is a prominent concern among those who prefer a market-based approach. The consideration of international models of universal healthcare has been crucial in shaping the U.S. debate. Countries like Canada, the United Kingdom, and various European nations provide examples of healthcare systems that aim to ensure universal coverage. Discussions often involve comparisons in terms of access to services, patient outcomes, and overall satisfaction. While these systems are cited as working examples of universal healthcare, critics argue that the unique social, economic, and political fabric of the United States requires a distinct approach. The relationship between employment and healthcare coverage in the U.S. adds a further layer to the debate. Historically, many Americans have received health insurance through their employers, which ties healthcare access closely to employment status. Proponents of universal healthcare argue that this connection creates vulnerabilities, leaving individuals without coverage during periods of unemployment. They suggest that a universal healthcare system would provide stability and continuity of care, irrespective of one's job situation. On the other hand, opponents present the argument that employer-provided coverage often comes with benefits, such as competitive rates due to the pooling of risk among employees. They also point to the flexibility that employer-based plans offer, allowing for a variety of coverage levels and options that cater to individual needs. The question of how a universal healthcare system would affect employer-based coverage remains a contentious issue, with potential implications for both the labor market and individual choice. At the center of the healthcare debate are also issues of equity and social justice. Advocates for universal healthcare underscore the disparities in access to healthcare services among different socioeconomic groups within the U.S. They advocate for a system that would close the gaps in healthcare quality and availability based on one's income, race, or geographic location. Addressing health disparities, they argue, is not only a matter of social equity, but also a means to improve overall public health and reduce healthcare costs by tackling preventable diseases more effectively. In contrast, critics caution that a universal healthcare system could lead to a leveling down of service quality. They fear that spreading resources too thin in an attempt to cover everyone could result in reduced access to specialized and high-quality care for those currently insured. The challenge of ensuring equity while maintaining quality and efficiency constitutes a substantial dilemma in the discourse around universal healthcare. The cost implications of universal healthcare are frequently cited by both proponents and opponents. Advocates argue that universal healthcare could lead to significant administrative cost savings by eliminating the need for multiple insurers and the associated complexities. They cite studies suggesting that a single-payer system could reduce overhead costs and simplify billing processes. Furthermore, the prospect of negotiating prices as a monopsony could give a universal healthcare system leverage to lower costs for pharmaceuticals and medical devices. Opponents, however, stress that the funding of a universal healthcare system would likely necessitate increased taxes, which they regard as economically disadvantageous and potentially unsustainable. They challenge the assumption that cost savings would materialize to the extent claimed by advocates, suggesting that inefficiencies inherent in government operations could negate any theoretical savings. The potential for escalating costs associated with universal healthcare remains a significant concern, particularly in light of the mounting national debt. As the discussion on universal healthcare evolves, the experience of the COVID-19 pandemic plays a profound role. The pandemic exposed vulnerabilities in healthcare systems worldwide, including the United States, revealing inequities in access to care and the importance of public health infrastructure. It has underscored the need for a system that can respond rapidly and equitably in a crisis, renewing the urgency for reform in the eyes of many. The ways in which the pandemic has influenced public opinion and policy priorities continue to shape the trajectory of the healthcare debate. The controversy over universal healthcare impacts numerous sectors, including the healthcare industry, employers, employees, and the government. Understanding the intricacies of this debate is complex, as it intertwines with economic, ethical, and political considerations. The decisions made in this arena will have long-lasting effects on the health and welfare of the American populace, making it a pivotal issue for both current and future generations. As the nation grapples with these challenges, the quest for a sustainable and equitable healthcare system remains at the forefront of domestic policy discussions. 2.4 Obamacare, Successes and Shortcomings. The Patient Protection and Affordable Care Act, commonly known as Obamacare, represents one of the most significant government expansions and regulatory overhauls of the U.S. healthcare system. Signed into law by President Barack Obama in 2010, its primary aims were to reduce the cost of health insurance coverage for those who could not afford it, and to expand healthcare access to millions of uninsured Americans. The Affordable Care Act, ACA, sought to extend insurance to over 30 million Americans by expanding both private and public insurance. The emergence of Obamacare coincided with a heated debate on the role of government in healthcare, an issue that has continued to stir controversy up to the present day, with stakeholders analyzing its successes and failures. One of the most significant achievements of Obamacare was the expansion of Medicaid, the federal state program that provides healthcare to low-income individuals and families. The ACA allowed states to expand Medicaid coverage to nearly all adults with incomes up to 138% of the federal poverty level. This expansion provided healthcare access to millions who were previously uninsured, particularly benefiting low-income adults without dependent children, a group that had not typically been eligible for Medicaid. However, the decision by the Supreme Court in 2012 to allow states to opt out of Medicaid expansion created a patchwork of coverage, where the benefits of the ACA were felt unevenly across the country. While some states embraced the expansion and saw significant decreases in their uninsured rates, others did not, leaving gaps in coverage for many low-income Americans. The introduction of health insurance marketplaces was another cornerstone of the ACA. These online exchanges allowed individuals and small businesses to compare and purchase health insurance plans, often with the help of government subsidies for those who qualify based on income levels. The subsidies, aimed at making healthcare more affordable, tied the amount of aid to income and the cost of benchmark plans in a given area. Millions of people were able to obtain insurance through these exchanges, which also imposed strict regulations on insurance companies, prohibiting practices such as denying coverage for pre-existing conditions and charging higher premiums based on an individual's medical history. However, these changes also led to a rise in premiums for some people, particularly those with higher incomes who did not qualify for subsidies and those in areas with less competition among insurers. While the law included measures aimed at containing healthcare costs, such as the introduction of accountable care organizations, ACOs, and the Independent Payment Advisory Board, IPAB, critics argue that it has not sufficiently slowed the increase in healthcare expenses. The individual mandate, which required most Americans to purchase health insurance or face a tax penalty, was a particularly controversial aspect of Obamacare. This mandate aimed to ensure that healthier individuals who might otherwise forego purchasing insurance would enter the risk pool, thereby helping to offset the cost of insuring sicker individuals. In theory, by expanding the number of insured persons, insurance costs would be distributed more broadly, helping to keep premiums in check for everyone. However, opposition to the individual mandate was fierce, with critics labeling it an overreach of government power. The Tax Cuts and Jobs Act of 2017 effectively repealed the individual mandate by reducing the penalty to zero, starting in 2019, which has led to concerns about the destabilization of insurance markets and increases in premiums. The ACA's requirements on employer-sponsored health plans marked notable changes, including the mandate that large employers offer health insurance to their full-time workers and that health plans cover a set of essential health benefits. It has influenced many employers to maintain health insurance coverage for their employees. While this has increased coverage rates, it has also resulted in additional costs for some businesses, which critics argue may lead to reduced wages, less hiring, or passing costs on to employees through higher health contributions, co-payments, or deductibles. The ACA also brought about changes in healthcare delivery and payment models intended to improve efficiency and patient outcomes. Initiatives like the Center for Medicare and Medicaid Innovation were tasked with experimenting with payment and service delivery models to reduce Medicare, Medicaid, and children's health insurance program expenditures while maintaining or improving the quality of care. Programs like the Hospital Readmissions Reduction Program and the establishment of the Patient-Centered Outcomes Research Institute aimed at improving healthcare quality and reducing costs. These measures have seen some success in lowering hospital readmissions and in promoting evidence-based medicine, but have also faced criticism for increasing the administrative burden and potentially stifling innovation in healthcare practices. Improvements in healthcare accessibility for individuals with pre-existing conditions remain a highlighted accomplishment of Obamacare. Prior to the ACA, many with existing health issues faced steep premiums or were outright denied coverage. Obamacare prohibited such practices, offering relief for these individuals, which was widely applauded as a crucial step toward a more equitable healthcare system. Nevertheless, opinions diverge as to whether reforms have gone far enough in ensuring the ongoing viability of protections for individuals with pre-existing conditions, given changes to the law and potential future adjustments. The comprehensive nature of the ACA has starkly illuminated the complexity of systemic reforms in American healthcare. By mandating a wide range of essential health benefits that all market plans must cover, including preventive services, maternity care, and mental health services, the ACA has significantly impacted the quality of insurance plans available. This comprehensive coverage approach is designed to ensure that more health needs are met and prevent disparities in care. The notion behind these mandates was to prevent junk insurance policies that fail to cover essential health needs and could leave consumers with inadequate protection. However, opponents of the ACA argue that this has limited consumer choice and driven up the cost of insurance for those who might prefer less comprehensive and consequently cheaper insurance policies. Understanding the complexities of Obamacare's successes and shortcomings offers essential insights into the broader discussion surrounding healthcare in the United States. Its passage sparked a plethora of legal challenges, political opposition, and attempts at repeal and replace, reflecting the contentious nature of health reform in a country deeply divided on matters of policy and the role of government. Despite these challenges, parts of the ACA have become deeply ingratiated in the fabric of American healthcare. Going forward, the ongoing debates and policy proposals surrounding healthcare continue to be greatly influenced by the ACA's framework. The shifts in public opinion, as well as the practical real-world effects of the legislation, have shaped subsequent discussions on healthcare reform. Looking into the future of American healthcare policy, lawmakers, stakeholders, and citizens alike must evaluate the weight of Obamacare's legacy, what it sought to accomplish, what it did achieve, and where it fell short. The assessment of these factors is crucial in the continual effort to build a healthcare system that is both effective and equitable for all Americans. 2.5 The intersection of healthcare and economics. The intersection of healthcare and economics is a multifaceted topic that takes on heightened significance in the context of modern America. The United States, unlike many other developed nations, does not have a system of universal healthcare. Instead, it operates primarily on a mix of privately owned and publicly funded healthcare systems. This particular structure has spawned numerous debates regarding the efficiency, equity, and sustainability of the American healthcare system. With the added complexity of a global pandemic, these discussions have become even more urgent and contentious. Healthcare economics fundamentally involves the analysis of how resources are allocated, including how healthcare services are financed and delivered. In the U.S., the healthcare sector is a major component of the economy, constituting a substantial portion of the gross domestic product, GDP. This considerable financial weight means that any shift in healthcare policy, such as the introduction of universal healthcare, could have profound economic implications. Proponents of universal healthcare argue that by streamlining administrative processes and expanding preventive care, overall expenditures can be reduced, benefiting the economy at large. Opponents counter that the high costs associated with implementing such a system could lead to increased taxes and potentially stifle economic growth. The balance between healthcare access and cost is a consistent theme in this discourse. While access to healthcare is critical for maintaining the overall health of the population, it also represents a significant economic burden for both individuals and governments. The cost of providing healthcare can limit access, particularly for those without insurance or with insufficient coverage. When individuals are unable to afford necessary treatments, they may forego care or seek it only when conditions become severe, leading to more intensive and expensive interventions. This dynamic highlights a paradox. Increased healthcare spending does not always equate to better health outcomes, but insufficient spending can lead to greater long-term costs, both in terms of finance and public health. The Affordable Care Act, ACA, enacted in 2010, sought to address some of these challenges by expanding insurance coverage and reforming certain aspects of the healthcare system. However, the ACA was met with political opposition and faced numerous challenges, including attempts at repeal. Its implementation illustrates the complexity of reforming healthcare in a way that balances economic considerations with the imperative of providing broad access to healthcare services. Critics of the ACA argue that it led to increased premiums and imposed regulatory burdens on businesses, while supporters point to the millions of additional Americans who gained insurance coverage as a definitive benefit of the policy. In the private sphere, the role of insurance companies in the American healthcare system is also subject to much debate. Health insurers are intended to protect individuals from the financial risks associated with health problems, but they also play a role in determining the cost and availability of care. The negotiation of rates between insurers and healthcare providers has a direct impact on the cost of care. Additionally, the profit motive of private insurance companies can sometimes seem at odds with the goal of providing comprehensive, accessible healthcare, as decisions about coverage and premium costs are influenced by business interests. The conversation around healthcare economics must also consider the allocation of resources for public health initiatives. These programs, which include preventative measures, education, and community health efforts, are pivotal for maintaining the health of the public and can be cost-saving in the long term. Such initiatives often face funding obstacles, though, as they do not provide immediate financial returns and compete with acute care and other pressing budget concerns. The prioritization of interventions that yield short-term savings over those with long-term health benefits is a recurring tension within health economics. The recent COVID-19 pandemic has further complicated the healthcare economic landscape. The substantial cost of emergency care for COVID-19 patients, coupled with the financial burdens of pandemic-related unemployment and business closures, has strained both the healthcare system and the larger economy. Questions about who bears the cost for such unprecedented care, the government, insurance companies, or individuals, have accentuated existing fissures in America's healthcare infrastructure. In the face of a pandemic, the interplay between health and economic stability becomes particularly evident, as a populace's health directly affects its ability to work and generate economic activity. Moreover, the pandemic underscored the interconnectedness of global economies and their reliance on resilient healthcare systems. Disruptions in one part of the world can have rapid and far-reaching economic repercussions elsewhere, as seen in the breakdown of international supply chains due to illness and lockdowns. This global dimension has led to calls for a reconsideration of how healthcare systems, particularly in an influential country like the U.S., are structured and financed, not only for the sake of domestic populations, but also for international economic stability. The pharmaceutical industry is another major player at the crossroads of healthcare and economics. The development of new drugs and medical technologies is a capital-intensive venture with the potential to save lives and reduce health-related suffering. However, The high cost of research and development is often passed on to healthcare consumers in the form of expensive medications and treatments, raising questions about affordability and access. Further complicating matters, the patent system, intended to incentivize innovation, can also lead to monopolistic pricing and restrict the availability of lower-cost generic alternatives. Considering the aging American population, the economic impact of long-term and geriatric care is another topic that can't be ignored. As people live longer, there is an increased demand for services that cater to the elderly, such as home care, assisted living, and long-term medical treatment. The cost of providing these services is substantial and will continue to rise as the baby boomer generation ages. This demographic shift necessitates a reconsideration of how such care is funded and managed, with an eye towards sustainable models that don't place an undue economic burden on the younger working population. Lastly, healthcare disparities and their economic dimensions are of critical importance in any discussion about the U.S. healthcare system. A healthcare system's equity is a measure of its fairness and inclusiveness. The existence of health disparities based on race, socioeconomic status, and geographic location not only has moral implications but also economic ones. When segments of the population are in poorer health, their diminished capacity to contribute productively to the economy can lead to wider gaps in income and opportunity, creating a cycle of health inequity and economic disadvantage. America's healthcare system, replete with complexities, stands at a critical juncture where choices made today will have long-term economic ramifications. Balancing cost with access, profitability with public good, and immediacy with future security, the intersection of healthcare and economics continues to be a challenging puzzle. The intricate relationship between individual health and economic viability suggests that investments in a robust and fair healthcare system could be foundational for a healthy and resilient economy. Moving forward, policy decisions will need to weigh immediate fiscal concerns against the broader objective of a healthy, productive society, informed by the lessons learned during the recent pandemic and the ongoing universal care debate. 2.6 Innovation and Technology in Modern Healthcare. The trajectory of healthcare has been significantly altered by the incorporation of technology, with innovations propelling the industry to uncharted territories of efficacy and complexity. These advancements are transforming how care is delivered, how health professionals work, and how patients engage with the healthcare system. The convergence of technology and healthcare presents a landscape filled with potential and fraught with challenges, yet it fundamentally aims to enhance patient outcomes, improve the efficiency of healthcare delivery, and reduce the costs associated with medical care. One pivotal development in healthcare innovation is the rise of telemedicine, offering patients access to medical consultation and care through digital communication tools. This shift, accelerated by the COVID-19 pandemic, has revealed the potential for telehealth to bridge the gap in medical service delivery, especially in rural and underserved regions. Telemedicine has enabled continual care without physical contact, allowed for the management of chronic conditions, facilitated mental health support, and has generally expanded the reach of healthcare services. However, it has also exposed and sometimes exacerbated disparities related to broadband access, digital literacy, and the suitability of remote care for complex medical conditions. Electronic health records, EHRs, have largely replaced paper files, offering a seamless method to store and manage patient data. EHRs facilitate the sharing of patient information across different healthcare settings, support clinical decision-making with comprehensive, up-to-date patient histories, and help prevent medical errors by flagging potential drug interactions and allergies. Despite their many advantages, EHRs have also been criticized for contributing to physician burnout due to increased administrative tasks. Moreover, concerns surrounding data privacy and security continue to loom over EHR usage, requiring constant vigilance and robust security protocols. Wearable medical devices and health monitoring tools have profoundly impacted patient engagement in healthcare. Devices such as smartwatches that track physical activity, sleep patterns, and vital signs, and sensors that can detect falls in elderly patients all serve to provide real-time health data. This continuous stream of information aids in more proactive and preventative healthcare, empowering patients to take control of their health and providing clinicians with invaluable insights. As these devices proliferate, the integration of their data with EHRs and other healthcare systems remains a key challenge, as does ensuring their accuracy and the interpretation of the data they provide. Artificial intelligence, AI, stands at the vanguard of medical technology, offering boundless opportunities for healthcare advancement. AI applications in diagnostics can analyze medical imaging faster and sometimes more accurately than human clinicians, providing a powerful support tool for radiologists and pathologists. Algorithms that predict patient risks, such as those for sepsis or readmission, are becoming increasingly commonplace in hospitals. However, the deployment of AI is accompanied by ethical questions about the accountability for errors, the opacity of certain algorithms, and biases inherent in the data used to train such systems. Precision medicine, driven by genetic and molecular information, is beginning to tailor treatments to individual patients, a contrast to the one-size-fits-all approach of conventional medicine. By identifying genetic markers, clinicians can predict a patient's response to certain medications, enabling more effective and less harmful treatments. The Human Genome Project's legacy, including the development of CRISPR gene editing technology, has expanded the horizons of what is possible in treating genetic diseases. Nonetheless, precision medicine is still in its infancy, and accessing these highly personalized treatments can be prohibitively expensive and is not equally available to all segments of society. In the operational realm, healthcare has benefited from logistical improvements through technology. Inventory management systems utilizing RFID tags and robotics in pharmacies for prescription filling reduce human error and enhance efficiency. Robot-assisted surgery, while not entirely new, is getting ever more sophisticated, improving precision in procedures and potentially reducing recovery times for patients. The data these tools generate can be used for further process improvement and cost reduction. Yet, the upfront costs of such technologies and the training required for their effective use are important considerations that can delay their adoption. The application of blockchain technology in healthcare is a developing area, promising to add layers of security and trust to the way sensitive patient data is handled. Blockchain could revolutionize data exchange among healthcare providers by creating immutable records of patient interactions and treatments. It can also streamline supply chain management for pharmaceuticals, effectively tracking and validating the authenticity of drugs. However, the scalability of blockchain systems and their interoperability with existing healthcare infrastructures pose significant hurdles. Another area where technology has made a formidable impact is in the realm of mental health support. Applications and platforms offering therapeutic services, from cognitive behavioral therapy to meditation and stress management, are making mental health care more accessible. These services mitigate some of the stigma associated with seeking mental health support and can provide immediate help to those who might otherwise face barriers to access. Still, the efficacy of digital mental health interventions as compared to traditional therapies requires ongoing research and standardization to ensure they are a beneficial adjunct or alternative to face-to-face care. The integration of Internet of Things (IoT) technology in healthcare systems has seen a swift rise, with connected devices providing a cohesive network to support patient care. Smart hospital beds that automatically adjust to improve patient comfort, and connected inhalers that track usage and feed data back to physicians for better asthma management exemplify the practical use of IoT. These systems generate large volumes of data that hold promise for predictive analytics and personalized care interventions. Yet, the increased connectivity also raises substantial security concerns as more entry points are created for potential cyberattacks. Finally, the potential for 3D printing in healthcare continues to evolve, offering the opportunity to create customized medical devices and implants, produce anatomical models for surgical planning, and in the more distant future, bioprint tissue for transplant. 3D printed prosthetics have already shown great promise in providing affordable, personalized solutions for patients. Research into bioprinting organs could one day address the shortage of donor organs, although the technical and ethical hurdles are considerable and will take time to overcome. The implementation of these technologies into the healthcare landscape is a process marked by trial and error, with each innovation offering potential mixed with challenges. While these advancements stand to reshape healthcare delivery, their integration must be managed thoughtfully, always prioritizing the safety, privacy, and best interests of patients. The road ahead for healthcare is undeniably linked with technology, and navigating this road will require a collaboration between technologists, healthcare providers, patients, and policymakers to fully realize the promise these innovations hold. 2.7 Mental health, the silent crisis. Mental health has long been a critical issue in the healthcare landscape, but traditionally, it has not received the same level of attention or resources as physical health. The reasons for this are manifold, including stigma, lack of awareness, and historical underfunding. Mental health conditions encompass a wide range of disorders, from common ailments such as depression and anxiety, to more complex conditions like schizophrenia and bipolar disorder. These disorders can deeply impact an individual's quality of life and may lead to reduced productivity, strained relationships, and increased likelihood of physical health issues. The prevalence of mental health disorders in the United States is significant. According to data from the National Institute of Mental Health, nearly 1 in 5 U.S. adults live with a mental illness. However, the accessibility and availability of treatment options are disproportionately low when compared to the demand. Access barriers include financial constraints, insufficient insurance coverage, stigma, and a shortage of mental health professionals, particularly in rural and underserved areas. These barriers can prevent individuals from seeking and receiving the care they require. The situation within child and adolescent populations is particularly alarming. An increasing number of young people are reporting symptoms of depression, anxiety, and suicidal ideation. The causes of this uptick are not fully understood, but are believed to include the pressures of social media, bullying, academic stress, and, more recently, the consequences of the COVID-19 pandemic. Schools and communities are often ill-equipped to address these concerns proactively, leaving many youths without the support they need during their formative years. The impact of the COVID-19 pandemic on mental health cannot be overstated. The pandemic has amplified existing mental health conditions and induced new stressors such as grief from the loss of loved ones, fear of illness, economic hardships, and social isolation. The psychological toll of the pandemic has increased the demand for mental health services, putting additional strain on an already overburdened system. Healthcare providers have reported a surge in patients seeking support for anxiety, depression, and substance abuse since the onset of the pandemic. Telehealth has emerged as a significant alternative to in-person therapy and counseling services during the pandemic. This adaptation of technology in healthcare has increased the reach of mental health services, allowing individuals to access care from their homes. However, while telehealth has broken down some barriers to access, concerns about the quality of care, privacy, and the impersonal nature of virtual interactions continue to be voiced by both patients and providers. Insurance coverage for mental health services is another aspect of the crisis. While the Mental Health Parity and Addiction Equity Act of 2008 was supposed to ensure that insurance coverage for mental health disorders is on par with coverage for physical disorders, the reality has fallen short. Many Americans still find that their insurance plans do not adequately cover mental health services, or they encounter high copays and deductibles that make treatment unaffordable. The debate over universal healthcare coverage in the United States includes a critical discussion about mental health services. Advocates of universal care argue that comprehensive coverage must include mental health treatment to ensure that all citizens receive the full spectrum of care. They believe this would not only improve individual lives, but also benefit society by reducing the indirect costs associated with untreated mental health conditions, such as lost productivity and increased healthcare expenses due to comorbid physical diseases. Contrarily, opponents of universal healthcare raise concerns about the cost and feasibility of providing such broad coverage. They often question whether the government can ensure high-quality care for mental health, as it does for other healthcare services. Some critics also argue that a one-size-fits-all approach may not be responsive to the diverse needs of individuals with mental health conditions. Regardless of one's stance on the universal care debate, the need for innovation in mental health care delivery is evident. This includes integrating mental health services into primary care settings, which can help reduce stigma and make mental health care more accessible. Collaborative care models that involve a team of professionals, including psychologists, social workers, nurses, and primary care providers, have shown promise for treating depression and anxiety effectively within these settings. Training and education about mental health must also be enhanced, both for healthcare providers and the general public. Mental health first aid courses, educational campaigns, and public health initiatives can play a role in improving mental health literacy, reducing stigma, and encouraging early intervention. By equipping individuals with the knowledge to recognize mental health issues and the confidence to seek help, society can foster a more supportive environment for those affected by mental illness. The mental health workforce shortage is a critical factor in addressing the silent crisis. The United States needs more mental health professionals, including psychiatrists, psychologists, counselors, and psychiatric nurses, to meet the current demand. Initiatives to incentivize careers in mental health, loan repayment programs, and increased funding for training programs can help address this shortage. Additionally, recruiting and retaining mental health professionals in rural and underserved areas is crucial to ensuring equitable access to care. Preventive measures are also an important part of managing the mental health crisis. This includes promoting mental well-being through community programs, reducing environmental stressors through policy changes, and supporting research into the causes and most effective treatments for mental health conditions. Prevention efforts can lessen the incidence and severity of mental health disorders, ultimately reducing the overall burden on the healthcare system. The economic impact of mental health disorders extends beyond the costs of treatment and loss of income due to disability. It includes indirect costs such as homelessness, incarceration, and chronic physical health conditions that often accompany untreated mental illness. Economic analysis of these broader impacts provides a compelling case for investing in mental health services, as the benefits of such investment would likely outweigh the costs over time. Looking at the wider societal context, it's clear that the United States faces deep-seated challenges that exacerbate mental health issues. These range from income inequality and social injustice to racism and other forms of discrimination, which can all have significant psychological repercussions. Addressing these systemic issues requires a cross-sector approach that involves government, the private sector, nonprofits, and community organizations working together to create a more inclusive and supportive society. In summary, mental health is a complex and multifaceted issue that touches every aspect of society. Effective solutions must be equally comprehensive, addressing not only treatment and access to care but also prevention, education, and societal factors that influence mental well-being. It's an ongoing challenge that will require concerted effort and innovative thinking to ensure that mental health is no longer a silent crisis, but a central component of overall health and wellness in the United States. 2.8 Disparities and Inequities in Healthcare. Access to quality healthcare is a fundamental need for all individuals. However, the United States is confronted with significant disparities and inequities within its healthcare system. Healthcare disparities are differences in health outcomes and their determinants between segments of the population, as defined by social, demographic, environmental, and geographic attributes. Health inequities, a subcategory of healthcare disparities, are disparities in health that are a result of systemic, avoidable, and unjust social and economic policies and practices that create barriers to opportunity. Socioeconomic status has a demonstrable link to healthcare outcomes. Individuals and communities with lower income levels often struggle with access to care due to costs, lack of insurance coverage, and limited healthcare resources in their neighborhoods. The cost of preventive care, treatments, and prescription medications can be prohibitively high without adequate insurance, which disproportionately affects lower-income families. These challenges can result in delayed or foregone care, leading to poorer overall health outcomes. Insurance coverage is a critical factor influencing healthcare access. People without health insurance are less likely to have a primary care provider, and they may not seek medical care due to the potential cost. Disparities are evident in insurance coverage rates across different ethnic and racial groups, with minorities often being underrepresented in those having access to private insurance and overrepresented in uninsured populations. The Affordable Care Act aimed to reduce these disparities, but gaps in coverage remain. Racial and ethnic disparities in healthcare are well documented. Black, Hispanic, Native American, and Alaska Native populations, in particular, often experience lower quality of care, higher rates of disease and disability, and increased mortality rates compared to their white counterparts. Language barriers, discrimination, and a lack of diversity among healthcare professionals contribute to these disparities. Culturally competent care and interpretation services are important for mitigating these issues, but they are not available in all communities. Geographic disparities in healthcare are also significant. People living in rural areas, for example, often have less access to healthcare services. Rural hospitals and clinics frequently have limited resources and staff, which can result in less available care. Rural residents may need to travel greater distances for healthcare, leading to increased costs and time away from work. Specialists and advanced medical services are predominantly concentrated in urban areas, which can disadvantage those residing in less populous regions. The quality of healthcare facilities and services can vary dramatically depending on location and demographics, contributing to inequities. Facilities in economically disadvantaged or minority communities often have fewer resources, lower staffing levels, and less access to advanced medical technologies. This can lead to different levels of care for patients based on where they live and how much they earn. Improving the quality and distribution of healthcare resources is vital for addressing these disparities. Behavioral health disparities are particularly troubling, as mental health and substance use disorders can profoundly affect quality of life. Rates of diagnosis and access to treatment for these conditions vary widely across different groups. Marginalized communities often have higher rates of substance abuse and less access to treatment due to cost, stigma, and a lack of available services. This is exacerbated by limited mental health provider availability in underserved areas. Preventive care is a cornerstone of reducing healthcare disparities. Screenings and early intervention can prevent more serious health issues and mitigate long-term costs. However, there are barriers to preventive care, including lack of awareness, cultural beliefs, and mistrust of the medical system. Communities of color and low-income populations have lower rates of preventive screenings, vaccinations, and other preventive services, leading to worse outcomes and higher healthcare costs over time. The pandemic-induced healthcare crisis has further highlighted these disparities. COVID-19 has disproportionately affected ethnic minorities in economically disadvantaged communities due to factors such as frontline job exposure, crowded living conditions, and prevalent comorbidities. Response to the pandemic, such as testing availability, vaccine distribution, and healthcare access during outbreaks, has varied significantly among different populations, exacerbating existing healthcare inequities. Overcoming healthcare disparities requires multifaceted strategies. Policy changes at the national and state levels that ensure equitable access to care for all populations are essential. Initiatives to increase health insurance coverage, expand Medicaid in more states, and incentivize healthcare professionals to work in underserved areas can help. Additionally, addressing non-medical determinants of health, such as education, housing, and food security, is crucial for reducing these disparities. Collaborations between healthcare providers, communities, and policymakers are necessary to reduce inequities. Community-centered health programs that account for local needs and cultural characteristics can be more effective in promoting health and wellness. Education campaigns that raise awareness of health issues and the importance of preventive care in different languages and formats can reach a broader audience. Creating a more diverse healthcare workforce can also help address cultural competency, ensuring that all patients receive respectful and effective care. In assessing the healthcare disparities and inequities in the United States, it is clear that vast improvements are needed. The complexities of these challenges are significant, involving economic, social, and political factors. A targeted approach that considers the specific needs of individual communities may offer the most promise for addressing healthcare disparities. Efforts to identify and close gaps in access, quality, and affordability of healthcare can contribute to a more equitable healthcare system for all Americans. 2.9 Healthcare Policy, Current Debates and Challenges. The healthcare policy landscape of the United States is currently marked by a range of debates and challenges that have been both exacerbated and highlighted by the aftermath of the COVID-19 pandemic. Arguably, the momentum for change in healthcare policy has never been greater. Central to these debates are questions of cost, access, quality of care, and the overall structure of the healthcare system itself. One major point of contention is the issue of universal healthcare and whether it should be adopted to ensure that all U.S. residents have health insurance coverage and access to care. One aspect of the current healthcare debate involves the cost of healthcare in the United States, which is notably higher than in many other developed nations. These costs manifest not only in insurance premiums, but also in out-of-pocket expenses for patients, including deductibles, co-payments, and co-insurance. Despite the high expenditure, Americans do not consistently receive better healthcare outcomes when compared to other developed countries. High costs contribute to issues with access, as some individuals forego necessary treatments or medications because they cannot afford them. Even with the Affordable Care Act, ACA, which aimed to bring down the number of uninsured Americans, the problem of people lacking insurance or being underinsured persists. Access to care is another critical debate point. Accessibility issues are experienced more acutely by certain demographics, including people of lower socioeconomic status, racial minorities, and those living in rural areas. The pandemic illuminated this issue, as communities with limited access to healthcare services experienced higher rates of COVID-19 infection and mortality. The debate around access to care often intersects with discussions on the disparities in the quality of care provided to different population segments. Many propose increasing funding for public healthcare programs like Medicaid and implementing policies to support rural hospitals and clinics. Quality of care is closely tied to the outcomes that healthcare systems produce. In the United States, the healthcare system struggles with a consistent level of quality across different providers and regions. Medical errors, variable care standards, and disparities in treatment outcomes are areas of concern. These issues suggest the need for policy changes that focus on improving healthcare practices, adopting evidence-based guidelines, and addressing institutional shortcomings that contribute to uneven care quality. The structure of the healthcare system itself is under scrutiny. The United States predominantly relies on employer-sponsored and private health insurance, with government programs like Medicare and Medicaid serving specific populations. This mix leads to a fragmented system that can be difficult for patients to navigate. There are proponents for a more centralized health system, advocating for models such as single-payer healthcare or Medicare for all. These models involve a significant shift in how healthcare is financed and managed, and they raise questions about the roles of government and the private sector in providing healthcare. The issue of a single-payer system versus the current multi-payer model is often debated among policymakers, healthcare professionals, and the public. Single-payer advocates argue that it would simplify the healthcare system, reduce administrative costs, and ensure universal coverage. Critics, however, express concern over the potential for increased wait times for services, reduced choice for consumers, and the feasibility of financing such a system through taxation. Additionally, there is a fear that a single-payer model may stifle innovation and lead to a deterioration in the quality of care. Another challenge within the healthcare policy debate is the future of the ACA, colloquially known as Obamacare. The ACA brought several reforms, including the establishment of health insurance marketplaces, subsidies for low-income individuals to purchase insurance, and the expansion of Medicaid in some states. Repeated legal challenges and attempts to repeal or undermine the ACA create an environment of uncertainty for patients, providers, and insurers. Policymakers must grapple with the question of whether to build on the ACA, overhaul it, or replace it with an entirely new system. Prescription drug prices are a crucial focus of the healthcare policy debate. The United States has some of the highest drug prices in the world, leading to public outcry and calls for regulation. Policy options to address this issue include allowing Medicare to negotiate drug prices, permitting the importation of drugs from countries with lower prices, and increasing transparency around how pharmaceutical companies set their prices. Mental health care has become an increasingly visible part of the healthcare policy conversation. The pandemic exposed and heightened mental health challenges, revealing inadequacies in mental health services accessibility and capacity. Policymakers are considering measures to integrate mental health care more thoroughly into primary care settings, increase funding for mental health services, and expand the mental health workforce. The goal of such policies would be to reduce stigma, enhance early intervention, and promote better overall mental well-being. Amidst these broad policy debates, the question of health equity remains a pivotal challenge. Social determinants of health such as income, education, housing, and neighborhood environments play a significant role in health outcomes. Policies that aim to address these determinants are critical to reducing health disparities and achieving greater equity. This involves cross-sector collaboration beyond the traditional healthcare arena and may include initiatives around affordable housing, education reform, and food security. Finally, the healthcare policy landscape is shaped by the influence of various stakeholders, including the insurance industry, pharmaceutical companies, hospitals, physicians' associations, and patient advocacy groups. The interplay of these interests can complicate policymaking, as each group brings different priorities and perspectives to the debate. Achieving consensus among stakeholders is often challenging, but essential for meaningful healthcare reform. Policymakers must navigate these complex relationships while keeping the well-being of the American public at the forefront of their efforts. Navigating healthcare policy requires a nuanced approach that balances the interests of a diverse set of stakeholders with the imperative of public health. The current debates and challenges in healthcare policy are not just political or economic concerns, they are matters that touch the lives of individuals and communities across the nation. Ensuring proactive, informed, and equitable healthcare policy will be central to the nation's ability to respond to current challenges and those yet to come. 2.10 Grassroots movements in healthcare advocacy. In the wake of emerging healthcare challenges, grassroots movements in the United States have played an increasingly vital role in advocating for comprehensive healthcare reform. These movements have been driven by a diverse range of participants, including patients, healthcare professionals, activists, and concerned citizens. Their actions are a direct response to the deficiencies they perceive in the healthcare system: high costs, limited access to services, and inequalities in the quality of care provided to different populations. They employ a variety of tactics, ranging from public demonstrations to sophisticated social media campaigns, to not only capture the attention of policymakers, but to also engage with the wider public and raise awareness about their causes. The effectiveness of grassroots movements in shaping healthcare policy cannot be underestimated. They have often succeeded in placing healthcare issues on the political agenda and ensuring they remain a priority for elected officials. The movements leverage the power of storytelling by encouraging people to share their personal experiences with the healthcare system. These narratives provide a powerful vehicle for illustrating the human impact of policy decisions and can be pivotal in swaying public opinion and garnering support for legislative change. The ability of grassroots movements to mobilize individuals around shared experiences and goals is a critical facet of their influence. Grassroots movements in the context of healthcare also play a key educational role. They disseminate information regarding health rights, insurance coverage, and how to navigate the healthcare system. This knowledge enables individuals to make informed decisions about their healthcare and advocate for themselves when necessary. The movements create resources such as guides, flyers, and websites, which serve as accessible points of reference for the community. By educating the public, these movements empower citizens to engage actively with healthcare providers, insurance companies, and legislators. Technology has been a transformative tool for grassroots movements in healthcare advocacy. Social media platforms in particular have been used effectively to organize events, share information quickly, and reach a wide audience. These technologies have lowered the barriers to entry for participation in advocacy, enabling anyone with an internet connection to participate in the conversation. Online petitions, virtual town halls, and hashtag campaigns can quickly draw significant attention to healthcare concerns and ideally lead to swift policy responses. Collaboration among different advocacy groups is another aspect of grassroots movements that can increase their impact. By forming coalitions, organizations can pool resources, share expertise, and coordinate efforts to achieve larger-scale change. These coalitions can present a united front to policymakers and the public, demonstrating widespread support for certain healthcare reforms. Such unity can make advocacy messages more compelling and harder for decision-makers to ignore. Despite the many strengths of grassroots movements, they also face significant challenges. Funding is often a critical obstacle, with many groups relying on donations and volunteer labor to sustain their activities. Without sufficient financial support, it can be difficult to maintain momentum and achieve long-term goals. Additionally, the decentralized and often informal nature of grassroots movements can lead to issues with coordination and strategy, potentially weakening their overall effectiveness. One notable example of a successful grassroots movement in healthcare was the advocacy around the Affordable Care Act, ACA. Supporters organized rallies, phone banks, and online campaigns to build support for the legislation. They also actively combated misinformation and clarified the benefits of the ACA to the public and legislators. These efforts were critical in the passing of the Act and demonstrated the power that grassroots organizing can exert on health policy development. Grassroots movements contribute to the democratization of healthcare policy by ensuring that the voices of everyday citizens are heard. In a landscape where healthcare policy can often seem dominated by industry interests and political maneuvering, these movements remind the governing bodies that policy should ultimately serve the people. By highlighting gaps in services and bringing forward suggestions for reform, they drive home the point that healthcare is a right, not a privilege. The role of healthcare professionals within grassroots movements is noteworthy. Their expertise lends credibility to advocacy efforts, and their first-hand experience provides insight into the workings of the healthcare system. When healthcare professionals join forces with patients and activists, they form a knowledgeable and persuasive coalition capable of engaging with both the public and policymakers on complex healthcare issues. Sustainability of grassroots movements is a concern that requires ongoing attention. To maintain their influence over time, these movements must continually engage new participants and adapt to the changing political and social landscape. This requires innovation in tactics and strategies, as well as a willingness to learn from past efforts, both successful and unsuccessful. Looking to the future, grassroots movements in healthcare advocacy will undeniably continue to play a crucial role in shaping health policy. As new healthcare challenges emerge, such as those presented by the aftermath of global pandemics or the debates surrounding universal care, these movements will need to evolve and respond to ensure they adequately represent the needs and values of the community. Their perseverance and adaptability will determine their future success as catalysts for change within the complex ecosystem of healthcare policy and reform. The ongoing debate around further healthcare system reforms provides these movements with an opportunity to further influence and advocate for equitable and accessible healthcare for all.